By the end of this week, children 5 to 11 could be getting the COVID-19 vaccine in Vermont. The CDC Advisory Committee voted to recommend the Pfizer vaccine for small kids late this afternoon. It is now up to the CDC director to sign off. Local 22's Dana Casulo talked with parents who you found out were in support of this today, Dana.
Parents I spoke with want their children to get the vaccine as soon as they can. COVID vaccine sites are getting ready to start vaccinating children ages 5 to 11. JAMAL AZIZ says his 11-year-old son, Isa, will get the vaccine.
I'm excited about him having it because this COVID fight it's been really bad.
AZIZ says he was concerned about the virus spreading at school.
It was very difficult to get him to get him to social distance. Many times I was worried that they can easily give each other this very bad virus.
Ryan Deal's children are 5 and 2.
We're extremely pleased and excited, and we will have her scheduled as soon as possible.
Deal says he does not have concerns about his daughter getting the vaccine.
We're fairly comfortable with the science and the reasoning behind the vaccine, and so we're very comfortable protecting our daughter and gaining a little bit more freedom.
Dr. Rebecca Bell is a pediatric critical care physician at UVM Children's Hospital. Dr. Bell says Pfizer's vaccine for children 5 to 11 is a smaller dose than the one given to people 12 and older.
This is the Pfizer-BioNTech vaccine, but it's 1/3 of the previous dose. So it's 10 micrograms as opposed to 30 micrograms. And this is because children's immune systems tend to have a more robust response.
It's authorized by the FDA as a 2-dose series, 3 weeks apart, but the storage of the vaccine is different.
The recommendations are a little less stringent, and that's helpful for these vaccines to be in clinics.
Dr. Bell says her 6-year-old will get the vaccine.
A really controlled way that their immune system can be prepared to fight off the virus in the future. And by getting vaccinated, we don't have to worry about them getting sick, and instead they can get protection.
And Dr. Bell says clinics will start next week. While parents I spoke with locally were eager to get their children vaccinated, there was a fair amount of vaccine hesitancy around the country. A recent Gallup poll conducted last month found 55% of parents with kids under the age of 12 plan to vaccinate their kids. And the Kaiser Family Foundation found 30% of kids ages 5 to 11 will definitely not vaccinate them. Reporting live in the newsroom, Dana Casulo, Local 22 News.